So good morning, everyone. We'd like to welcome you to Massy Live, our live webinar series where we come together to discuss topics that are meaningful to all of us. This morning, especially, we want to take a moment to send our thoughts and support to our Jamaican colleagues and their families as they experience the storm this morning. We're with you during this challenging time. We also extend belated Independence Day wishes to our St. Vincent colleagues. We hope you had a wonderful celebration. And today's discussion focuses on an important topic, one that I think has touched many of our lives, whether it's through a friend or a colleague or a family member. And so we sincerely thank the Massy Pulse team for putting this together. And so I'll hand over to Tanya. Thank you, Tanya.
Thank you, Katrina. So good morning, everybody, and welcome to our Massy Live webinar. Can you mute your mics, please?
I think Christian. Yeah.
Thank
Christian
you.
can mute. Yeah, thank you.
Okay, so I am Tanya Rawlinson from the People and Culture Team, Wellness and Benefits, here at Massy, and it's such a pleasure to have all of you here joining us for this special session called Let's Talk Pink, a breast cancer awareness conversation. So October is globally recognized as Breast Cancer Awareness Month, and today we come together not only to raise awareness, but also to empower ourselves with knowledge, understanding, and hope. Let's take this moment to reflect, raise awareness, and remind ourselves that early detection truly saves lives. So through the Massy Live, we create these spaces to learn, connect, and take simple but meaningful steps towards better health and well-being. And this morning, we'll hear from two incredible women who bring both medical expertise and lived experience to the table. Firstly, I want to introduce Dr. Asante LeBlanc. She's no stranger to the Massy family. She has guided us through some of our most meaningful health and wellness conversations over the years, and we're truly honored to have her back with us today. So today she's joining us all the way from India. So please help me welcome Dr. Asante Van West Charles LeBlanc, founder and medical director of the Victoria Clinic. She's a Cuban-born Guyanese, and I'm going to tag in Trinity the Bone, and a proud mother of five wife, doctor, clinical densitometrist, and medical herbalist. Her passion has always been to guide individuals along their road to optimum health. In her practice, she blends the best of both worlds, integrating complementary and traditional medicine with conventional Western medicine to provide truly holistic care. Now, after the loss of her grandmother to cancer, Dr. LeBlanc made it her mission to do more for those affected by this disease. She began working with the Trinidad and Tobago Cancer Society, one of our country's longest-standing NGOs, where she served as chairperson for 5 years, and she continues to serve today as a member of the board of directors. She has been the face and voice of the Cancer Society, leading the charge for greater screening, education, and early detection, while also helping shape national policy on cancer awareness and prevention. Beyond her professional achievements, Dr. LeBlanc is known for her love of reading, music, dancing, laughter, and family. Her mission continues to be promoting healthy lifestyles and healing through the harmony of Eastern and Western medicine. Dr. LeBlanc, grateful to have you here back joining us and continuing to inspire. Over to you.
Oh my gosh. Good morning. It's nice for me. And I did a crazy thing. I got my mehendi for the wedding and it's still wet, so I'm really this is quite an interesting experience. But I'm so happy to be here with the Massy family, with all the countries, and it's so important, such an important discussion. I love that you said that October is breast cancer awareness, and this really, it doesn't mean that breast cancer only occurs in October, but it's about empowerment and reminders, because this is an incredible disease for us in the Caribbean, for West Indian women. And I mean, I'm not going to be morbid, but we're just thinking 1 in 3 women, so 1 in 3 of our group will be affected by breast cancer, and that is in itself daunting. And so it's great for us to have these conversations. As you know, my conversations are usually very real, those who know me. And, I look forward to answering questions if I do. So I'm going to share my presentation. I'm so happy and I'm so looking forward to hearing the other speaker as well. So I'm going to share my screen. My handy has dried, so I should be able to do this. Here we go. And it's not the right page. Let me find, yeah, there we go. Breast cancer awareness. Great. So I always like to say to everybody can see the screen, by the way. Yes, I can see, you can see the screen, right? So I always say and start these conversations by cancer because everyone thinks, oh my God, cancer is death, cancer is a crab. What is cancer? Cancer is just a disease, it's going to kill us. But in a nutshell, cancer is a bunch of bad behaved cells. Now, from a medical standpoint, it's the term we use for diseases in which abnormal cells divide without any control. Again, bad behaved cells. And then these abnormal cells invade other tissues and form big tumors in most cases. So cancer is not just one disease. In fact, there's so many different, there are more than 100 different cancers, and it's based on the type of cell that it started from. So we named the cancer, and in this case, breast cancer, because it started from the breast tissue. So this is just for you to understand what I mean by bad behaved cells. Now, our bodies are amazing in that when you think you're controlling everything, as long as you're in optimum wellness and health, your body actually does things that you don't know it's doing. So we all have pluripotent cells. A cell that can do anything it wants based on the environment that it's existing in. And so what happens is these cells divide. Now, as they're dividing, if there's an error, we have armies that go through and they say, oops, this is not working. Let's kill this cell. Let's take it away. And also, our cells are programmed to die. Depending on the type of cell, they're programmed to die at a specific time. Why am I telling you this? Because if that machinery, those two mechanisms don't work for any reason, and in this case, be it lifestyle and other risk factors, which we will go through, then the bad cell, which is the green cell here, continues to behave badly and divide with its badness. And its badness just doesn't stop. And there we get the tumors. So that, in a nutshell, is what cancer is. But then over the years, we recognize that cancer is not only just bad behaved cells, it's actually based on our lifestyle as well. Why am I saying this? So cancer is one of what we call the NCDs, or the chronic non-communicable diseases, which are the group of diseases which actually are most responsible or responsible for the most amount of deaths in our region, in the Caribbean, and in the world, dare I say. Breast cancer is the most prevalent cancer in women in Trinidad and Tobago, in the region, and in the world. And it accounts for the greatest proportion of cancer deaths in women in Trinidad, in the Caribbean, and in the world. In hindsight, or now, we look at it as breast cancer actually being something of a pandemic. Somebody's talking. So tumors. So everybody feels their breast during October because they forget their breast exists out of October. And then they feel something in their breast and they say, oh my God, it's a lump, and they're going to die. But, calm down. So we have two types of tumors, or two types of lumps. We have benign lumps and we have malignant lumps. Benign means not cancer, will not develop into cancer. Very rarely are they life-threatening. So these are your cysts, your fibroadenomas. So you hear all these things. When people tell you, well, if you do your mammogram, I hope you do your mammograms and your ultrasounds, or you feel up your breast, you do your self-breast examination, and they say you have lumpy breasts. So that means that you have lumps that are not life-threatening. They're not malignant, right? And these benign tumors do not spread to other parts of the body. Breast cancer is a malignant tumor. This means it's cancerous. It may be life-threatening. And I want you to absorb that word, may be life-threatening, because cancer does not have to equate death. The diagnosis does not have to equate death, and we'll go into that later. Malignant tumors can invade and do invade neighboring tissues and spread to other parts of the body, and that is the process called metastasis. Yeah? So what are risk factors of breast cancer? We start with the simple things we cannot change: our family history. We cannot change if mommy had cancer, granny had cancer, and it's very important, if we can, to understand daddy's side of the family. Some people say, I don't know my father, don't want to know him. That's fine. Know his family. Just understand their history, because that is so important in how it impacts us as well. Our age. So Again, remember the machinery I showed you? So the older you are, where is why are they moving my presentation? Something happened to my presentation there. I'm going to share again. Okay, good. So your age, so it varies. Now, this used to be the risk factor where we said the older the woman, the more risk for breast cancer. But, and I'm not being a Debbie Downer, we have seen post-pandemic in these last couple of years, we're seeing younger women suffering from breast cancer. We're asking ourselves why. We do think that it's a combination of factors. We can't blame COVID alone. We think that there are a combination of factors, including our lifestyle, our stress coping mechanisms, as well as other factors. Yeah. Another risk factor is ionizing radiation. This means if you're working around radiation, you're at risk for most cancers, and in this case, breast cancer. Certain chemicals, such as formaldehyde and asbestos, these are carcinogenic chemicals, and we know of them, and we try to stay clear of them, and we always are aware of those chemicals around us. Other risk factors. So yes, the older a woman is when she has her first child. So now you're going to say, well, Dr. LeBlanc, you mean I must have a child early? No. All this, and take this with a grain of salt. All we're saying is the older you are when you have your first child, there's a difference in the hormonal exposure. So we're seeing it as a risk factor, but it's not the biggest risk factor. So don't get panicky and go and have a child at 20, right? Women who've never had children, again, don't panic if you never had a child. That does not mean you're going to have breast cancer. We're just taking this and letting you know that if this is applying to you, you need to understand your risk and therefore make sure that you get screened. Menstruation, if you start menstruating before the age of 12, if you go through menopause after the age of 55, and if you use long-term hormonal replacement therapies or oral contraceptives. Now, this is a big debate. Structure by when that this is a big debate now because, of course, with perimenopause and menopause, which I talk about often as well, everybody's like, well, I need HRT. I can't take these hot sweats. I can't take these hot flashes, and they want HRT. And that's fine, but we're looking at how long you're going to be on the HRT and your long-term exposure to exogenous hormones. Yeah? Your diet. Now, remember I told you that cancer is a lifestyle disease. So what does this mean? This is the modifiable aspect to your preventative or your pillar of prevention against breast cancer. How we eat, the quality of food. Are you eating high trans fats, high processed sugars, high processed foods in your diet, a lot of salt intake, excessive alcohol intake? Those are very, very important factors to look at. And if we couple that with lack of physical activity, lack of exercise, and being more than selectively plump, so being overweight and obese, then those are big risk factors when it comes to our lifestyle. And then smoking and vaping, obviously. Tobacco use is a no-no, vaping is a no-no. Now, alcohol use. I know this is going to scare everybody because even me, I like my little tips every now and again, but excessive alcohol use. So what we're going to say is if you don't drink, don't start. And if you're drinking, cut down. Because we are seeing research that alcohol is a factor for breast cancer. Now, can I tell you in a high stress environment, eat well, exercise, sleep, don't stress, don't smoke, don't vape, don't drink, and just be purist? I really can't honestly tell you that at this time. It is the ideal, but it's not what we're going to get all the time. So what I want you to be aware of is that excessive alcohol intake. That means you cannot have a bottle of wine every day. You cannot overdo the rum, the vodka, the gin and tonic, the skinny mocktails, cocktails every day. We have to have moderation, and that is key. And I want you to take that home so that we're not going to go from 0 to 100 and think that that's going to save, everything. So understand that when we talk about alcohol. So when we talk about breast cancer, what are we looking at? What are signs and symptoms? Now, this is important for ladies to understand and men. So it's important to understand that men do get breast cancer, but it's a very smaller percentage. So yes, we're taking care of the ladies today, but men, I want you to listen as well. So what are signs and symptoms of breast cancer? Very so like they'll tell you, well, I felt a lump, or my husband or my partner felt a lump. You hear different stories. But what are things we look out for? Look at your breasts and the sizes. Your breasts are never going to be the same size. going to be markedly different. So you can't have one breast that's a triple D and one that's a B, and that's normal. So a huge difference in size of a breast that happened almost overnight, like in a month or so, that's a possible sign or symptom. A lump in your breast or under your arm, or what we call the axillary region, your armpit. Unusual bloody or a yellow purulent discharge from one nipple, especially if it's unilateral. That's a little more alarming than if it's bilateral from both nipples. Yeah, your nipple was out and now it's in, so an inverted nipple that you never had. The skin around your breast looks like the skin around your breast looks like a rough skin lemon or an orange. They call it peau d'orange. And I don't speak a lot of French, I speak more Spanish. So that could be a warning sign. When around your areola or your nipple gets red and like a rash and just itchy all of a sudden. Now, if a mosquito bites you on your breast and all of a sudden you're itching your breast, don't think you have breast cancer. Pay attention, look at it and see what's happening, okay? All of a sudden you see a lot of flaky skin around the nipple area and that's lasting more than a month, that should be checked out. Changes in what I told you, the size and the shape of the breast, because sometimes the breast retracts instead of getting bigger. You feel a tightness and more pain in the breast. And of course, the thickening or swelling of any part of your breast. These are possible signs and symptoms. Now, that's just the breast tissue. Other general symptoms can include, and this is if the tumor is spreading, especially pain in your chest, like especially your chest bone and your back. You could get shortness of breath. You could get generalized fatigue, and you're all going to say, oh my God, I tired all the time. I have breast cancer. No, it's a real strange fatigue that you're feeling, and just not feeling well. And women, we know, listen to your bodies, use your intuition. You know when something is not right in your body. So those are generally the signs and symptoms of breast cancer. As I told you, men have breasts as well. They don't always admit it. And so what we do for men is we recommend that they just pay attention if they see a lump in their breast or anything, to immediately get checked out, because we really don't screen men per se, of course, depending on their family history. You would have heard later in the game, or lately, you've heard about genetic testing. And I brought this into the slide today because I thought, first of all, I've done this lecture for Massy before and it can be boring all the time. But most importantly, we have to bring you up to date. So genetic testing, and I know all of y'all know Angelina Jolie, Patti LaBelle, they cut off their breasts, they have nice perky ones that they did pay for. They look really great. And that was because they had family members with breast cancer. They did their genetic testing and they found the BRCA1, BRCA2 mutation. BRCA1, BRCA2 are genes in our genome, our DNA. If there's a mutation in these genes, then it doesn't mean you're getting breast cancer. It puts you at risk for breast cancer and other gynecological cancers, right? So what we do is we use genetic testing, and we're trying to use it more in Trinidad and in the Caribbean, actually, because if a patient is diagnosed with breast cancer and we genetically test that patient, it allows us to determine the risk of that patient in terms of other cancers that they may develop, gynecological cancers. It allows us to then tell that patient, tell your family that you need to get screened, get checked out because you have that mutation. And then we then test those family members to see if they have the mutation, because then it allows us to tailor their screening more tailored to their mutation positivity, so to speak. So genetic testing is being used more and more because it does help us. And I don't want you to think, oh my God, if I don't get genetic testing, I'll never know. Let me tell you something. It is another if you don't think, and I tell people this all the time, if I have BRCA1, BRCA2 mutation, am I going to empty my entrails and cut off my breasts? I'm not too sure about that. But what it does do is give me information to say, how am I going to do my screening? How am I going to live my life? What's my lifestyle going to be to allow me the increased survivorship should I be diagnosed with breast cancer? And that is what we're talking about. We're not talking about immediately doing, cut off everything, empty everything. Because I know patients, and I know one person in particular, she did prophylactic, which means preventative mastectomies, like Angelina Jolie. And yet, years later, she because they didn't take all the breast tissue out on her arm. So she was still diagnosed with breast cancer. So in her mind, she didn't. medicine, I tell you this because no matter what, you still have to pay attention to your body and understand how you're feeling. And that's all I want you to take away from that slide. So what's screening? Because we're talking about screening. Screening is looking for trouble. Screening is where the so-called normal population. So basically, we are looking for the disease before actual signs and symptoms show up. So before you feel that lump, we're looking for the lump. Before you feel anything, we're looking for it to say, okay, if we find it and we work it up and it's breast cancer, we have early detection. And therefore, the treatment strategy is much easier and your survivorship is much, much increased with the breast cancer. Yeah. So key for us in breast cancer in terms of beating breast cancer, in terms of decreasing the mortality or death caused by breast cancer in our region amongst our women. And it's important for us to understand that because in the first world, the so-called developed world, they're decreasing the numbers of death by breast cancer in women due to the increased screening. And this is why we in our region need to be empowered, not be fearful of screening, understand what screening involves, and get screened regularly so that we can have early detection to increase our survivorship. So what does screening for breast cancer look like? The beautiful thing about screening for breast cancer is that it's not just one test, and it's not only involving me, the doctor, or the mammographer. So we start with you, the individuals. We start with training you to do your monthly self-breast examination. When do you do that breast exam? I tell everybody to teach their young girls from very young, once they start menstruating, how to examine their breasts. Why? You need to understand what your breasts feel like before your period, during ovulation, just before you during your period, and just after your period. Why? Because all those times of our reproductive cycle, our breast tissue will be influenced by hormones, and therefore our breast tissue will change. And it's important for you to understand what your breasts feel like. If you have dense and lumpy breasts, know the lumps because you'll know when a lump changing. So ideally, we do our monthly self breast examination about 5 to 7 days after our period, and that we substitute. I'm going to be real with you. I know nobody's going to remember every month, although we should. So every other month is what I'll give you. But please just make sure you do your self-breast exam because you are then able to tell your physician something is different. This breast feels different. This lump feels different. And that is what is important. You feel the lump. Understand what you're feeling when you go to the physician with that lump in your breast, right? Then every year, your doctor should do your clinical breast examination. So your doctor does the examination in his or her office, and there we look at the size, the shape, the texture of the breast tissue, and then we do the mammogram. The mammogram is an extra picture of the breast. So we usually start mammograms between the ages of 35 to 40. Here's the caveat. Depending on your family history, and if you have a huge genetic risk, and if you have a lot of family members that may have died or had breast cancer at an earlier age, your screening time, the time you start your mammogram may be different, and that will be individualized for you, the patient. However, we usually start in general between 35 to 40 years of age, and a mammogram is done every year. The new guidelines are saying, especially with women with dense breast tissue, which is almost all of us of Afro-Caribbean heritage, that we should do the mammogram and the breast ultrasound. Yep. So usually when we do the mammogram may come back and say, oh, it looks clear, but there's dense breast tissue, so can you please do an ultrasound as well? It's not either or. The gold standard screening test at this time is still the mammogram. Yep. And then depending on that, we will decide if we need to do any other screening tests. So the breast ultrasound is done. And then we come to the breast MRI. So the breast MRI is used in specific cases, and that is used not all the time as a screening test, but it can be used because it does give us a lot of false positives as well in dense breast tissue. So you do your screening every year, you're going along hunky-dory. 1 year you do your mammogram, and they say, we found a spot. Don't panic. If we find a spot on your breast and we do the mammogram and the ultrasound, then we do what we call a spot compression. What's a spot compression? Spot compression means we're going to press a little harder just on that spot, as it says, to see what we're seeing. Based on that, We then will determine if we need to do an ultrasound guided biopsy or a true cut biopsy of the lesion that we're seeing. And from there, we would send that off to pathology, and then we will see what comes back. So it may come back as nothing, and it may come back as breast cancer. I'm telling you this because I've had many patients who go hyperventilating, but you can't be fearful. And I know it's hard because I know you're saying, well, she could say, don't be fearful. And I agree. But we have to also understand that until that histology comes back as positive, you do not have breast cancer. You have to understand that it has to be a process. So don't put fear into the mix. What we have to do is be empowered and know that because you're screening, you're going to catch anything early, and early detection is what truly saves lives. And that is so important. So we do the breast biopsy, find needle aspiration or true cut biopsy, and that's how we would diagnose breast cancer. And then goes treatment. We have different options for treatment. It's surgery, it's chemo, hormonal therapy, and radiation therapy. I know everybody panics and they go, oh my God, chemo, I'm going to lose my hair. And I agree. I have a friend right now who has stage 3 breast cancer, and she has had almost every single side effect you could think of with the chemo. And now she's without her breast and she's going through those steps, and I'm walking through that with her. But what I can tell you is that your mind, positivity is key, your lifestyle is key, and knowing that a diagnosis of breast cancer does not have to equate death. You understand? And I say that to you positively. I say that to you because I see it in my friends, I see it in my family, and I've seen it in my patients. And I don't want you to lose hope. This is where we empower you not to lose hope. So we spoke about lifestyle. So everybody's going to say, well, I hear when you get diagnosed with cancer, no meat, no sugar, no salt, only juice. Don't do that to yourself. You want to eat as clean as possible even before a diagnosis of breast cancer. You want to make sure that your lifestyle, your diet is as natural as possible. We in the Caribbean are so blessed to have our foods that are natural, and we have to go back to basics. So I want you to remember that in terms of how we eat. We have to eat as natural as possible. We have our ground provisions, our whole grains. Remember not to have excessively processed foods, not to have a lot of high sugar, processed sugars in your diet, not to have excess salt in your diet. Exercise, sleep is so important, listening to your body, stress coping mechanisms. And we speak about mental health all the time. Mental health is a big part of it. And you know, when people speak about mental health, they go, oh, we need to name mental health an NCD. Now, the definition of health is the balance of mind, body, and spirit. What does that mean? Without mental health, you weren't going to be healthy anyways. Therefore, you have to sleep. You have to get your nervous system in tune, because without that, then there's no true health. And I want you to understand that. So breast cancer is daunting. It is a disease we have to fight, and we have a mandate. All of us in the Caribbean with PAHO, united with PAHO, we have to bring down the incidence and the prevalence, meaning how many coming up new and how many we have in the country. But most importantly, we need to bring down the deaths caused by breast cancer. And to do this, we need more sessions like this. We need to empower women out there. We need men to empower the women in their lives. We need women to empower the women in their lives to get screened, to remember the pillars for us to fight this disease. And that is truly how we will overcome this disease, save lives, and really, truly be survivors. Yeah? And that is so, so important. So I hope you got the takeaways. I look forward to your questions, and I thank you for your time and attention. I think I did it in record time, I hope.
Absolutely. Thank you so much, Dr. LeBlanc, for sharing not just your knowledge, but your compassion and holistic perspective. After today, we definitely have in mind cancer does not have to mean death. It's not a death sentence. And you reminded us of how powerful awareness, prevention, and lifestyle choices can be. And we truly appreciate you for always inspiring us to take charge of our health. So we still have another guest. We're moving from the medical insights to move to a story of strength, faith, and perseverance. And we have our guest, Miss Jem Bunny. She's an educator, advocate, and breast cancer survivor whose journey began in 2019 when she was just 31 years old. With courage, humor, and the love of her family, she has faced her diagnosis of triple positive breast cancer head on. And today she uses her voice to help others through awareness and education. She's also part of Know Your Lemons, a global breast health education program that empowers women and men around the world to recognize the signs of breast cancer early. Remember that early detection. So, Jem, thank you so much for joining us. We're truly honored to have you here with us today. Handing over to you.
Good morning. I hope you can hear me. Can you hear me?
Yes, we can.
Okay, good.
Yes.
So, as it was said, my name is Jen Bonnet, and I am now 38 years old. So, it's been 6 years since I was diagnosed. So, survivor. Yes, early detection.
Congratulations.
Thank you. Early detection definitely is a core part of the charity that I work with, which is Know Your Lemons. Because the only way that we can have early detection is if you know the symptoms and you know the signs. One, you need to understand that it's not just one symptom, there are 12. And I'm sure that the doctor went through those a little bit, but I want to show you the image that really changed my mind. So I'm going to share I hope I can share it properly because sometimes these like to do very strange things. Okay, good. All right, I hope you can see that. Can you see that image?
Not yet.
Okay, let me see. I hope it's gonna come up. It says I'm sharing.
So we're seeing the Teams, join your Teams meeting tab.
Join your team meetings tab. Okay, I am sharing this. Today is not my day when it comes to technology, but that's no problem. But I'm going to encourage you to go to knowyourlemons.com, knowyourlemons.org afterwards so you can see the image. So there are 12 signs of breast cancer, and I did not know the sign that I had was a sign of breast cancer because this is something that wasn't explicitly taught. I knew about the hard lump and I knew about nothing else. But what happened in my case is I started getting some pain in a particular part of my breast, my right breast, and then I started to get an indentation near my areola. I didn't know that that was a symptom, but my mother, thank God for mothers, she said, I think you should go and get that checked. So I did, and it happens that my gynecologist also was the gynecologist who delivered me as a baby. So he knew me from the time I was born. So as soon as I came in, he said, okay, Jen, we're not going to play with this. You're going to come in and we're going to go and have the ultrasound because since I was 31, they weren't sure about my breast density. So they said, hey, we're not going to do the mammogram. We're going to do the ultrasound instead. I went for the ultrasound 2 days later, and my gynecologist also goes to church with me. So I took it straight from the appointment, went to him, handed him the information. He's like, okay, Jen, I'm going to refer you to the surgeon because I can do the biopsy. Because remember, the doctor just said, in order to confirm that it is breast cancer, you do need to do the biopsy. So he said, no, I'm going to send you straight to the surgeon in order to get that biopsy done. And the surgeon was a little bit busy, but my doctor called and said, nah, you need to get her in. And went ahead, got that biopsy done. Was a very simple procedure, a little bit painful, but a little pain is better in the long run. Then he called me a couple of weeks later and he said the words I will never forget. Jem, I'm sorry to say, you have cancer. And I can honestly tell you, I cried. And but it wasn't like gut wrenching tears. It was a little bit, and my husband was with me, and I had to go off for tests. As soon as I got in the car, my husband said, "Jem, if you need to cry, you need to cry," and I just broke down. We went ahead, and I can say that at every stage, the doctors here were ahead of me. They were saying, "Okay, we're going to do this test, we're going to do that test, we're going to do this, we're going to do that." Now, my journey is a little bit different because as a adolescent and young adult person with breast cancer, instead of doing surgery first, which is a common treatment protocol, I had chemotherapy first because they wanted to try to drink the mass before we went into surgery. So I went through that. And yes, I lost my hair. And doctor did not say that, but you don't just lose the hair on your head. My eyebrows were gone. My eyelashes were gone. The hair on my legs was gone. I wish it kept gone. I did not grow back after chemotherapy, but it came back. All hair from all over, to the point where I actually went ahead and actually kind of pulled my eyelashes out because they kept falling into my eyes. And you know how annoying that can be. I also had bone pain. It felt like if my bones were being broken apart with the second half of the chemotherapy I was going through. And then I had surgery. I actually had two sets of surgery. So there's one, the first one I had is a lumpectomy. So that's where they go and they take out the mass, the lump, and some of the area around it. And I also had some lymph nodes removed because they wanted to make sure that the cancer had not spread beyond the lymph nodes that we had detected with the biopsy. Then after that, we realized that while the chemotherapy had shrunk the cancer, it had actually, my cancer was diffuse, so it was spread throughout the breast. And that is what the pathology report brought. So I had already decided from the time I was diagnosed, if I need to do a mastectomy, that's the way I'm going to go. So I asked my doctor, my surgeon, he's a sweetheart, Dr. Lewis, the best. He said, Jem, if you want to do this, I will support you in that. And we decided to do bilateral mastectomy. So that's when you remove both breasts instead of just one. And I can tell you, I don't know how many people are believers or believe in a higher power. I do believe because this was in 2020 and COVID was coming. This was before the lockdown. And my doctor kept, he said, nah, Jem, I'm going to pull up that surgery date. And then he said, no, 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 Jem, I'm going to pull up the surgery date. And I went into the surgery. He said, you don't even have to pay me. Pay the hospital first because they went privately. Pay the hospital first, and you could deal with me after. I had the surgery one day, and then the next day the hospital shut down for lockdown. So yes, I do believe in a higher power making sure that I was going through this. I also had to do something called Herceptin because since I'm triple positive, it means that the breast cancer cells are receptive or they grow in response to estrogen, progesterone, and a protein called HER2. And there was a movie about that. I'm not sure if you may have seen that, but it was a movie about the doctor who discovered that and was able to create Herceptin. So I had to go on Herceptin. I don't know if you know, Herceptin is expensive. But again, going through our system, the doctors here said, okay, we'll make the letter to go to the council at Queen Elizabeth Hospital here, and I did not have to pay for the 18 injections that I had to get, and they were more than $1,000 each. So I had the Herceptin, I had chemotherapy, and then it also had to have my ovaries removed because, again, my type of cancer is triple positive. So we wanted to reduce the estrogen that was in my body. I don't know how many of you are going through menopause, but menopause hits like a brick. And not one brick, a whole wall of bricks. And because it was surgically induced, it hit me not a little bit, a lot harder than it may have if it had came on gradually. And right now, that's where I am in the throes of menopause. And it is not my friend at all. Additionally, I did have radiation to my right side from my neck, breast, and under my armpit because I did have some spread to a couple of lymph nodes. And I can tell you honestly, I didn't know I was going to have radiation. I could swear that during the session, they didn't tell me anything, but my husband said, yes, they did. So, what I would say, if you are going through my journey, I really hope you don't because it's not an easy journey. It is a great club because we are all supportive of each other, but I don't want anybody else to join this club. But if you are going through this journey, I would suggest a couple of things. One, have someone who can be an advocate for you. When you're going through this, you're going to be going through a lot of emotions. You're going to be going through things where you feel cloudy, where you're sick, where you're having side effects. So having someone there or having someone on the phone while you're going through appointments so they can listen in and ask questions that you may have forgotten to ask, that is always a great thing. Two, do research, but don't do too much research because you can frighten yourself with all the things on Dr. Google. That's the honest truth. Look for reputable sites like Know Your Lemons, and there are also some other cancer websites like the American Cancer Society and some of the ones based in England. They usually have very up-to-date information. That's a good place. Work with your primary. Everyone will have a different protocol because you have a different genetic makeup, you have different risks. Actually, that person with cancer, hereditary, I see Trinidad Cancer Society and Barbados Cancer Society here as well. Only 50% of the persons who develop breast cancer have a hereditary, have it in their family. 85%, they're the first persons. The other thing I'm going to ask you to do is to really look out for share as much as you can. You've learned a lot here. Don't let it stay with you. Let it go to your family, to your friends, to your colleagues. Within our organization, Know Your Lemons, we actually had one of our Lemonistas, because the global breast health educators are called Lemonistas, and she did it for her company. And for some reason, the majority of the people there were men. However, one of the men who was there, he went home and he was talking to his mother. His mother was like, "Oh, don't talk about that because it's a little bit taboo to talk about breasts and whatnot." And especially since he was a man. And he's like, "No, mom, you need to know this." And then she listened to what he was saying and realized that she had a symptom. And she was able to go and get tested. And she was at stage 2. And she was able to get the treatment that she needed. So, men, you have a big part to play. You're influential. And don't say that I say this, but if you're in a relationship, you can tell honey, I need to touch a little bit more to make sure you don't have any lumps or you don't have anything, or can look at you. Oh, yes, I can see both of them still look the same size. One isn't turning. There's no, yeah, don't say I said that, but you can use that as your little thing. And the last thing I'm going to say is continue to be open to learning. The world of breast cancer is rapidly changing as we work towards getting a cure, as we work towards making sure that patients are getting the resources that they need. So it's very dynamic, it's very changing. So keep up to date. I am always going to plug Know Your Lemons because we are making sure that you know what you need to know, because early detection needs two things: knowing symptoms and knowing when to get screened. And you need to know your risk so that you can get screened at the right time, and to also know as your breast density so you will know if mammograms are for you or if ultrasounds are for you. I really do not want you to join me on my journey. I really don't. So I implore you, please continue to educate yourselves and don't let it be pink. But let it be the pink here so you continue to know about breast cancer. Thank you.
Thank you so much, Jem. That was a powerful and personal story. Your openness, faith, and resilience remind us of how much strength can come from vulnerability and how vital awareness and early detection truly are. We are so grateful that you have chosen to share this journey with us today. And guys, please be reminded we have both Jem and Dr. LeBlanc here. If you all have any questions, now's a good time to ask them from both a point of expertise and from experience, first-hand experience. So you can raise your hand or you can put it in the chat.
I just want to thank Jam for telling that story. It was really, really inspirational, and your positivity is really infectious. So thank you so much for sharing that. Tony, I put the link in the chat that Jam was trying to share the image of it. I looked at it. It's a very powerful image. So I don't know if y'all would like to share in the meanwhile whilst people are coming up with their questions.
Katrina, as you have it open, can you share it? Oh, you have it.
Sure.
Yeah.
this. Is this
Paula?
it? You seeing it?
No. Yes.
Yeah? Jam, is this the image that you were trying to share?
Yes, this is the image that I was trying to share. Our founder used lemons because in places where it's a little bit
Oh,
taboo, the lemon structure does look like a breast. It has the C that represents the hard lump so persons can understand that. So this, you can look at this. You don't even need to read it. You can look at it. So it's very good in places where literacy might be a little bit lower, and it also opens places where it might be a taboo to talk about it openly. But this is the image that got me interested in Know Your Lemons, and this is one of the images that I definitely share every single year.
thank you. I think Paula has a question. Paula, you have your hand up?
Yes, good morning, everybody. Jem, I really want to thank you for sharing your story with us. I hear about breast cancer and you watch things on TV, but you never really get pulled into the true life experience of somebody who is reeling in front of you. And I want to say I'm so happy that you have recovered, you're in remission, your cancer is gone, and I pray that your continued health just continues. Thank you so much for sharing that part of your life with us. It really moved me. I'm actually here a bit choked up. But thank you. I have a question for Dr. LeBlanc. Doctor, I was on HRT as I completed my year. I went on HRT for a year because my symptoms, my perimenopause symptoms were so severe. And I ended up deciding that I would stop after a year, not for any reason. So when you talked about prolonged use, it just hit me because I stopped at the end of August, but now my symptoms are coming back, my hot flashes and a part of me thought, if I can't do this, should I go back on? But after hearing you know, I think I have to give that some serious thought as to whether I should. I just want to get your view on it after being on it for a year. What would you advise me to do at this time if I was considering starting back the HRT? Thank you.
Yeah, so I love that question. I aim to be the menopause, perimenopause queen of the Caribbean soon. That's my manifestation. So the thing is that I speak to women every time, and when Tanya read that bio of me, I keep saying I'm gonna send a bio one day saying I'm just a goddamn selectively plump perimenopausal woman about to enter 50 and loving it. But so the reality is that Paula, I tell women that we have to understand that this is a natural transition of our reproductive lives. However, what does this mean for us? From a Chinese medicine perspective, and this is where I come in with my integrative approach to health, where I bring together the Eastern and Western branches of medicine, we have to look at how we eat. So simple things, and I mean, I couldn't give you everything now, but simple things, and shameless plug, if you follow me, Victoria Clinic _ Trinidad, you'll see more. But simple things like cucumber water, eating ground provisions such as yams, green fig, breadfruit, using dal, kitchery, oxtail, nourishing foods. And we look, and if you want to do Google, you want to Google yin foods. Because if we build our yin in our body, then we're building our natural reserves of all coolness, everything that controls those out of whack yang fires. So that is your night sweats, your frustration, your dry vagina, your irritability, your 1 minute bipolarism, all of that. So we have to work with it. And so does this mean that everything is going to go if you do what Dr. LeBlanc says? No. But it is a way for us to not have to depend on HRT. Because I always tell my gynecologist colleagues, I say, when you give a woman HRT, how long are they on HRT for? And what is HRT really doing? Because if I teach a woman how to naturally embrace this transition, exercising, understanding how to eat, doing certain techniques, doing acupuncture, hormone balancing naturally, then I'm actually helping her with the root cause of the problem versus giving her HRT, not doing anything else. And then when she feels all nice and sexy and everything, and then I go, yo, we got to take that off. And then when it comes off, they go, oh my God, I'm hot again because you gave her a plaster on a sore. So it has to be about moderation. So my humble suggestion is to find someone like me. I don't know if there are many like me, to be very honest. But a natural transition. You can reach out to me on my page as well. I really I'm trying to empower our women in the Caribbean not to become first world women. Understand that this is a transition, that we don't have to grin and bear it, that there are things we can do. And for the younger women out there, being proactive, preparing our bodies for that natural transition is like the best thing we could do for ourselves. But if you're in it, don't despair. We can change certain things, Paula, such as cucumber water, watermelon, cucumber with salt, cashew nuts, almond nuts. I mean, I could give you a whole list, right? And we do those things along with certain practices, and you will see a definite decrease in your hot flashes and most of your symptoms. And then if you still need a little bit of HRT, well, then you take a TUPS, but then you'll be able to come off. But all that while you're training your body, you're regenerating and restoring that yin to allow you to survive the transition, so to speak, and come out of it looking like, wow, because I think that's what women need to understand, that menopause doesn't mean we're stopping. It's a pause. It's just a transition. We're coming out fabulous at the other end, because that's what it is. You understand? It means no more pregnancies. That's what we need to look at. You can still have good sex. You can still be happy. It don't mean it's all gone. Yeah. So that's what I
Thank you
recommend.
so much, Dr. LeBlanc. I don't know if you remember, but you did give me acupressure for my hot flashes one time. I'm definitely going to be checking you out because I do need to find a more strategically better and healthier solution to the problems that I'm having. But thank you so much. Thank you for everything. You were really helpful with me the last time, but we do need to talk. Thank you.
No problem. Tony, I think
Um,
I saw a question.
yes, a question for you, Dr. LeBlanc. Are there
Are
any
there any
promising clinical trials or research currently underway in breast cancer research?
Amazing, yes. I mean, and that's why, for example, Jem gave you this story, and Jem, I mean, Jem was amazing. And I have a few friends I'm walking through this journey, and they're almost like Jem. But the reason Jem is having this experience is due to research and ongoing research. So we're really trying not only to help Caucasian women and first world women. So they're doing research on the Caribbean women and looking at Black women, even African American women, because we all know we're from the motherland anyways. But we really are doing a lot more research so that, number one, your chemo has less side effects. We haven't gotten there yet, but also how can we do tolerable side effects? How can we look to see, for example, if it's hormone receptive, if it's triple negative? We're looking at all those things. So long ago, it used to be you got breast cancer, bam, bam, bam. Now it's like, well, let's look at the hormone receptors. Let's look at the type of tumor. Let's look at what's happening, the risk factors, and then bring it together as one in terms. So there's a lot more research. But the thing is, Tony, we have not found, we said we haven't found a cure. But the thing is that in essence, when we put a woman in remission and she's allowed to be a survivor, we have technically found a cure. You understand? But the reality is it's multi-pronged. It's a multiple disciplinary approach. And so with the research, we learn more about lifestyle. We learn more about what we can modify. We learn more about what we cannot modify, and learn more about what we can do to treat to help the women really survive this and come out of it living a good life and enjoying their lives. Yeah. So there is research going on. We have not found the definite injection that if you're diagnosed, we can give it to you and bada bing, bada boom, you don't have cancer, but we're getting there. And that's what the walks are about. That's what fundraising is about in certain circles. So it's not only just empowerment, but in certain cases we raise money for research as well. So it's very, very important. Soursop, everybody hears about soursop. They're doing research. don't discount your soursop tea. I hate soursop to a core, and I think that's because they gave me too much when I was a child. But I guess if I get breast cancer, I will be sucking that soursop. But eating that soursop, having that soursop tea. I mean, it's not only that we have literature where soursop has properties, but we just can't say don't do chemo, eat soursop. You know what I mean? And that's important as well. It's not either or. So there are herbs, there are supplements that we can use during chemo, before chemo, after chemo, that can help the patient actually feel a lot better during that journey as well.
Doc, I think you have a question from Charmaine. Tanya.
Yes. Hi, Doc. Can you still get cancer if you had a total hysterectomy? Do you still have to do pap smears?
Well, it depends on what cancer we're talking about. So if you're talking about breast cancer, you can still get breast cancer if you had a total hysterectomy, because that's me taking out your uterus. Now, you can have a hysterectomy, being a total hysterectomy, and they could still leave your ovaries in place. So that's not with an oophorectomy. Or you can have a total hysterectomy plus a bilateral oophorectomy, where I take everything out. Or you can have a subtotal hysterectomy, where they left a little piece of your cervix. So if they've left a little piece of your cervix, you have to do your pap smears every year. Now, here's the kicker. If they took everything out and left you with just a vault, we still recommend that you do a vault smear after your surgery, at least for 5 years, because the vault is, you still have, especially if you're still sexually active, because you can still have damage to the vault. So you can still get a cancer in the vault. It's not frequent, but we do recommend it. So it won't be called a pap smear. It will be called a vault smear. Yeah. And if you're talking about breast cancer, if you do a hysterectomy, yes, you can still get breast cancer even though you take out your uterus, because they're two different cancers. But if you talk womb cancer, endometrial cancer, ovarian cancer, cervical cancer, it depends on the type of hysterectomy that's been done. Yeah. Jem has a question. Did chemo and radiation bring about any other medical condition that you're battling? Here we go.
Well, the radiation did damage some of the nerves that are under my armpit. So I do have a kind of a chronic pain under there right now. The chemo, I still get a little bit of chemo fog, but if that's chemo or the menopause, well, that's a big toss-up, because menopause does bring that brain fog along with it. So right now, the majority of the symptoms that I am experiencing are from the menopause, and also because I am on a medication called letrozole, again because I was on, my cancer is triple positive. They have me on something which is aromatase inhibitor, so that lowers my estrogen as well, but it does have side effects. So and the longer that you're on it, the more side effects you get. But because I was young at the time, they do want to keep me on it a little bit longer, because they want to give me the best possible outcome that we can have right now. So that leads me into, how do I take care of my mental health throughout the experience? There are a couple of things I do. One, I rely on my family a lot. I must say, having support of your family and friends is a great way to take care of your mental health. I know too, I am in too many Facebook groups where women's husbands and partners have left when they got their diagnosis, or after they've had their mastectomy, or after they've had that. So I am very, very grateful. My husband is he's a G, as people say. He's a real soldier. So he keeps there. And my dad recently died, but my mom and my family are always around me. They keep me going. My friends at church, my friends at work, they constantly are in contact with me. They keep me going. And honestly, just getting away sometimes. Sometimes you just need to go by the beach, put your feet in the sand, and sit down there and listen to the water. Honestly. But I do read. I keep trying to do the things that I normally would do. I recently did an escape room with my friends, which was a good way to just get out of my head. And sometimes you need to lean into the fears and the sadness you're having and experience that. Don't try to bottle it up. And then say, okay, you know what? Yeah, I'm feeling this. I'm experiencing this. And then look at it, feel it, and then let it go. And one of the things that I learned from somebody else was one day, one day at a time. And if you can't do 1 day, do 1 hour. If you can't do 1 hour, do 1 minute. If you can't do 1 minute, you could do 1 second. And God takes you through every second so you could get through it. And sometimes you need to break it down to that small thing so that it's easier for you to get through the situations that you may be going through. On my part, at least.
And Jam, you can use simple things like tulsi, which is holy basil. You can
Mhm.
use tulsi and chamomile. Those are nerve vines, so they will help you with what you're feeling under the armpit, and they will also help your mental health as well. You can use, and here we go, marijuana oil. So I usually mix it with some, I usually do a mix with marijuana. I get the pure marijuana oil and then add some CBD, and then I add some peppermint and maybe some of the other calming, like St. John's wort oil if you find it. And you can rub that on the areas of the numbness or the nerve pain. And for your menopause symptoms, which you will feel forever with letrozole until you come off of it. So you combat that using cucumber water, cucumber slices with salt on it. So slight salt. So you make a semi chow. So you could put cucumber and apples, and you can have that every other day. Walnuts is key if you're not allergic to nuts. So you can use walnuts, a handful of walnuts every day. Oxtail is important for you, and lamb. So even if they tell you that you have cholesterol or anything, tell them F it, and you can have that at least 3 times. I behaved myself, Tony. I didn't say the whole word. So you can have that at least 2 times to 3 times a week. And dal is so important. So Bajans don't know about dal, but learn about it and get some good Indian dal in you at least 3 times a week. And that's a good detox and restorative food as well. Yeah.
Okay, so this was really, I mean, we always wish when we have these sessions that we have more time, especially when we bring two dynamic speakers as we did today. So as we wrap up today's live session, I want to once again thank these two amazing ladies, Dr. Asante LeBlanc and Mrs. Jam Bonet. And thank you for sharing your wisdom, courage, your stories with us. And thank you to all of you who have joined us today and participated in the chat and took time to learn, reflect, and show support. Let's keep the conversation going beyond today. Encourage your loved ones to get their screenings done. Remind your friends to check in on themselves and keep spreading the message that early detection saves lives. To the few men that we've sent y'all on a mission today. We know that you all are going to also spread the word. And as they said, as a man, you also have to be able to check yourself. You all could also continue to this wellness journey through the MyPulse app, where you will find helpful resources, health tips, and recordings of sessions just like this one. So on behalf of the Massy Pulse team, I want to say thank you again for being a part of this very important conversation. Let's keep showing up, supporting each other, and talking pink. Have a wonderful day, everybody, and take good care.
Bye, everyone.
Thank
Thanks for
you. And
having
nice meeting you,
me.
Bye.
Jam. Bye. Have a good
Bye.
one.